night, a young guy hooked up with a girl, and in the thrust of passion, the pair decided not to use a condom. A couple weeks later, he started feeling unwell and developed a cough that lasted a bit too long. While the first HIV test came back negative, the second one did not. Today, he is one of the 1.1 million people estimated to be living with HIV in the US according to the Centers for Disease Control and Prevention statistics. HIV/AIDS is a disease whose prevalence shows no signs of abating, and since there is no cure for the disease, the most potent form of prevention is awareness. HIV/AIDS is one of the worst pandemics that has infected and killed many people all over the world. As a future health professional, I have an interest in learning medicine, viral diseases, and their treatments. Also, as a person who was born in a city where the first case of HIV in the Republic of Belarus was reported, I was exposed to many educational, informational, and training materials about HIV and AIDS. Today, first, I will explain the nature of HIV/AIDS. Second, I will discuss the ways of HIV/AIDS transmission. And finally, we will talk about the symptoms and risk factors of HIV/AIDS. Acquired immunodeficiency syndrome, or AIDS, is a clinical condition that occurs due to an infection with the human immunodeficiency virus, or HIV. Infection with the human immunodeficiency virus, or HIV, leads to a progressive destruction of the human immune system, at the point where the immune system is no longer able to defend against pathogens. HIV-positive individuals frequently present with opportunistic infections. According to the article AIDS and Infections, written by Christine Curry, these infections can be divided into several categories, including bacterial, viral, fungal, and protozoan infections. The same source states that the most common bacterial infection in those living with HIV is the pathogen that causes tuberculosis. Christine Curry continues that Candida is the most common HIV-related fungal infection. And as for viral infections, they also can have severe consequences for those living with HIV. For example, human herpes, human papillomavirus, Epstein-Barr virus, that lead to higher rates of the Kaposi sarcoma, AIDS-related lymphoma, and invasive cervical cancer, respectively. One of the most common protozoa or single-cell parasite infections in people with HIV, according to the same source, is encephalitis, or in other words, inflammation of the brain. AIDS, or acquired immune deficiency syndrome, is the end stage of an infection disease caused by the human immunodeficiency virus. Gale Encyclopedia of Nursing and Allied Health states that HIV infection progresses in stages as the virus gradually weakens the body's immune system. The source continues that it takes an average of 11 years for HIV infection to progress to AIDS, although the disease progresses faster in children and the elderly. AIDS is diagnosed when the count of certain white blood cells in the patient's blood drops to a critical level, or the patient develops life-threatening tumors or opportunistic infections, some of the authors. Now that I've discussed the nature of HIV/AIDS, I will now discuss the ways HIV and AIDS can be transmitted. HIV is carried in blood fluids, in body fluids such as blood, semen, saliva, or vaginal secretions, breast milk, and they're passed on when infected fluids into the body. The risk of acquiring an infection varies greatly with the type of exposure. The International Encyclopedia of Human Sexuality, edited by Patricia Willingham and Ann Ballen, states that transmission of the human immunodeficiency virus has been identified to occur through 4 main routes. This broadly includes sexual contact, mother-to-fetus transmission, transfusion of infected blood products, and sharing infected needles during injected drug use, continues the source. The primary mode by which the virus establishes a presence in the body is the exchange of or contact with infected body fluids across mucous membranes. Such exchanges usually occur through the walls of the vagina and the rectum, as well as through the membranes of the penis, say the authors of the article. The second most important route of infection is contact with infected blood products. Most commonly, this is through the exchange of contaminated needles by intravenous drug users, according to the authors of the article 8 from the Huntington Unabridged Encyclopedia with Atlas and Weather Guide. HIV is a fragile virus and cannot normally survive more than a few minutes outside its host. Draining of bodily fluids containing HIV effectively neutralizes the virus, continues the source. Not all modes of transmission seem to be equally efficient in spreading the virus. Pregnant or women infected with HIV are unlikely to pass it on to the fetus while in the uterus, but are quite likely to do so via vaginal fluids during birth or after breastfeeding the child, claim the authors of the article HIV from the Huntington Unabridged Encyclopedia with Atlas and Weather Guide. HIV is not transmitted in every bodily fluid. According to the same study, HIV cannot be passed on through contact with sweat, tears, urine, feces, sputum, or nasal fluids. Researchers prove that HIV is destroyed in saliva and cannot be transmitted by casual contact with bodily fluids such as kissing or coughing. Now that we have learned about the ways of HIV and AIDS transmission, I would like to discuss its symptoms and risk factors. HIV is an extraordinary, complicated pandemic that can be recognized by specific symptoms, and its transmission is facilitated by certain social behaviors, for example, injection drug use or unprotected sex, and that may be mitigated through harm reduction strategies. In its early stages, HIV infection often causes transient flu-like symptoms. Among those symptoms, the author of the Harvard Medical School Health Topics A to Z named fever, sore throat, rash, nausea, vomiting, joint pain. In a small number of cases, this early stage of infection may progress to meningitis, continues the article, as well as person may begin to develop swollen lymph nodes and skin problems, for example, shingles, seborrheic dermatitis, psoriasis, and minor infections, ulcers, ulcers around the mouth and herpes, oral or genital. In the next few years, symptoms can get even worse. Many people develop diarrhea, fever, unexplained weight loss, joint and muscle pain. An opportunistic infection can develop. This type of infections include specific causes of pneumonia, diarrhea, eye infections, and meningitis. Some types of cancer can develop. These cancers can include advanced cervical cancer, Kaposi sarcoma, non-Hodgkin's lymphoma, and also brain lymphoma. HIV risk behavior generally refers to the behaviors that lead to possible transmissions of HIV and increase the likelihood of having HIV infection. Research up to date published in the article HIV Risk Behavior from Encyclopedia of Nursing and Research has identified that HIV is mainly transmitted through unprotected penetrative, vaginal or anal intercourse and oral sex with infected person, through blood transfusion with contaminated blood, by using contaminated syringes, needles, or other sharp instruments, and also from an infected mother to her child during pregnancy, childbirth, and breastfeeding. Today, I first explained the nature of HIV and AIDS. Then we discussed the ways of HIV and AIDS transmission. And finally, we talked about the symptoms and risk factors of HIV and AIDS. HIV/AIDS is one of the world's pandemics that have infected and killed many people all over the world. In conclusion, I would like to say that the AIDS and HIV virus is a very dangerous disease that sees no race, no color, no gender, no economic background, and not even a specific age group. It can affect anyone, at any time, and everybody is at risk. Although there is no cure for the disease, the most important form of prevention is to fight the cloud of ignorance about the HIV and AIDS crisis, and the best time to start is right now. Thank you for your attention, and thank you for being my audience today.